أهلا وسهلا. معكم بودكاست جراح. أنا الدكتور لؤي السالمي، استشاري التجميل. معي الدكتور المميز من تركيا، الدكتور اوردين إكميجي، متخصص في زراعة الشعر من تركيا. الحلقة اليوم راح تكون بالإنجليزي عشان الدكتور اوردين. So welcome Dr. Ordin to the podcast. It's in Arabic it's named Jarrah, which is surgeon. So today we want to take the time to know more about you. You're a well-known hair transplant physician in Turkey. You have a very strong practice, very famous. We know that you have fantastic results, and we are very happy to have you today here in Riyadh and in Rejuvera Clinic to talk more to our audience about hair transplant, what we should do, what is the new technologies, everything, and give us some idea about Turkey and where you come from, Turkey. So please introduce yourself.
First of all, thank you so much for your invitation. I am so happy to see you. I am Dr. Ordin İkmekçi. I come from Turkey. I have a experience about hair transplant for years. I have been working these things for years. I have a own clinic in Istanbul. Also, I am going sometimes Qatar, Dubai. Inshallah, we will soon here start the business together. Today we have to talk about hair transplant. You know that we are using food technology. Right now we are using few hair transplant because when we have been using food technology, it was the backside we are seeing like scar, but few technology is last technology. We are taking the backside graft 1.1, and then after hair transplant, they cannot understand you had hair transplant. This is very good for the people because everybody, they don't want to see they had hair transplant. This is very important for us. Also, I am using what kind of hair transplant I am doing. I am doing few hair transplant. Also, the direct hair implantation hair transplant. What is the different Safir Füye hair transplant and DH hair transplants? Safir Füye hair transplant, last technology. Safir means like diamond material. When we have to open channels, when we are making hair transplant, it can be not damage skin. Also, the recovery is very easy. We don't get too much blood after hair transplant. And then the client's happy, we are happy, we didn't get any infection, any side effect, because this is really very good and last technology. The direct hair implantation, for example, you had one session hair transplant, you are a business person, you are a government person like that. If you don't want to shave your hair, all your hair, we can use direct hair implantation without shaving your hair. Just we are taking backside the graft, and then we have to put the pencil to directly transplant your head.
Okay. Now, tell us more about what you need to do before surgery. Like, if I want to do hair transplant, what are the things I should do before surgery?
Before surgery, we must do very good consultation with clients. This is very, very important. We have to get like some anamnesis. Do you have some issue? Do you use some medication? Did you get some operation? Do you have like cancer? Do you have like diabetes, hypertension? And then do you have some cardiology problem? Maybe some clients, they are using like blood circulation bills. And then before 1 week or 10 days, we have to stop about these things. Maybe they have like some hypoglycemia. And then also we have to talk with the client's doctor. We have to get the information. After that, we start the hair transplant.
Mm-hmm. Talk us through, like, if I come and do hair transplantation, what should I expect? What should I expect when I have the session? What is the scenario? What is going to happen?
First of all, again, we have to do consultation. We have get many clients right now, like they start the 18 years until 45, 50 years. And then now new generation, they have a very big problem, hair loss problem, because you know that hormone is not stable, every day changing. We are not eating very healthy food. Some people, they are doing like workout, they are using the same time like some straight, and then we are seeing many clients this issue. They are losing too much hair, and then we have to choose clients. If the clients like the young generation, first of all, we have to get like plasma, mesotherapy, maybe sometimes we are giving to some vitamin tablets, bills to care to maximum year. If they, for example, if they come to us 25, 30, and 35, after consultation, if they need hair transplant, we can do. But we are telling to honestly, first of all, we can do first session. After that, maybe you need the second transplant, and then we are giving the all information before hair transplant, because hair loss stop like until 35.
Okay. And for example, you were talking about to me before the podcast about a solution. There's also a possibility that some patients you treat with solution without hair transplant.
Yeah, for example, the literature telling us you have, if you have a hair loss problem, you have to two way. First of all, you have to start minoxidil lotion, and then second things, you have to use your clients. You start your clients propecia or finasteride. We start also. I recommend my clients before, but I see many side effects. For example, minoxidil very good effect. When they have to stop the minoxidil to use, they are losing the hair again. Also, when they are using the minoxidil, when they are taking shower, because the minoxidil is coming down body, and then body the growing hair, and then they are not happy. The other ways, otherwise, the finasteride is very good high density and strong cane, but we are seeing also the side effect. What is the side effect? Like erection problem, down libido, sexuality, you know that. And then when I am explaining before the treatment, all clients, they are afraid. What we did, because in Turkey, we are very famous about hair transplant, about surgery, all doctor, we are doing some solution. This is like finasteride solution. When we start like the 1 month, 2 months, 3 months, we have to see result like the 30% and 40%, 50%. 6 months, we have to see 100% result. It is, and then we didn't get side effect, and then we see good effect and very successful. Just we have to put the lotion, and then we have to do massage. That's it. Yeah, because people, when they have to take the blood bills, they are scared, because the bills all body the effect, but the topical lotion only this area, the hair area.
Which is good. That's good. Now, if let's say you had a hair transplant, how long do you think do you need to do another hair transplant? What is the usual course?
Normally, when we have to do one sessions, after 1 year we can do second sessions. But it is depends. For example, if it is new generation, if we can do 25 years old client's hair transplant, we must make maybe 10 years. And then we have to do second transplant, last step, and then they have to be get like very good result.
Okay. Now, let's say, what is the quality of the hair when you transplant it? Is it the same quality as your own hair?
Yeah, it is same quality, but when we are doing hair transplant, your team is very important. Your team be very successful, and then your team had be a very good experience about hair transplant, because when we start the front line, we have to see they have to see the result very natural, and then we take the back side like the follicle graft, one graft, 3 follicle. We cannot put the in front of area 3 follicle. We have to separate. We can start like the 1 or 2 follicle to front area, front line. After that, we have to continue to back side 3 follicle.
Okay. Now, if I had a hair transplant, can I decide how my hairline is, or do you decide how the hairline should be?
No, of course we have to agree with our clients, but for hairline, your muscles showing us to hairline. When we have to the examination, I am telling my clients up your eyebrows. When they have to up your eyebrows, we are seeing the line, the muscles. Always help us. After that we draw. If he is agree, we can start. If you want a little bit down, we can do. But normally also literature saying us, like for example, lateral side, you have to put like to 8.5 and 9. In the middle side, you have to put like 7. Okay. Understand? Yeah. We have to check each area. It will be symmetry.
And when you do the hairline, do you look at past pictures, or you just rely on your?
Of course, past pictures. So yes, you know that some clients they are coming with pictures. They said when I was young, I have like that hairline. If it is possible, we can do these things. Okay. So yes, we will try. This is important.
Yeah, because the hairline. Because I always get this question about where do you think the possible hairline you can do? So I think it's your judgment mainly, what you can achieve. Yes. on the. Okay, so what would you tell a patient who is reluctant? Yani he wants a hair transplant, but he's afraid. What do you tell that patient?
Yeah, normally, for example, all people, they are searching to Google, YouTube, and then they are seeing when they are doing hair transplant, they are seeing blood, they are feeling pain, and then they are talking each others. But right now, we are using last technology. We are carrying our client. This is very important. For me, it's very important because I did hair transplant myself. I am feeling my clients, what they are feeling. Yes. When they are laid down, when they get the hair transplant, you know that it is like 5-6 hours totally. Yeah. And then I am understanding 100% my clients. And then I will care them more. Mm-hmm. And then also we are using like less technology needle. Which one is we are using when we are doing Botox, it's like very thin needle. Also, sometimes they need to with sedation. We are giving also some sedation tablet. Also, we are giving some under anesthesiologist also IV sedation. It can be relaxed. They will be happy. They didn't feel nothing. Okay. Technology is now going every day up. Yes.
Yeah. So if a patient is afraid or has anxiety, he can do it under sedation.
Yes, why they are afraid, because maybe they didn't meet a very professional who is making hair transplant. They are talking each other, they are hearing, and then they are afraid.
Yes. And now, most patients, when you do a hair transplant, there's a lot of things they have to take care of after surgery. Can you explain the things the most important things after surgery?
Of course. After hair transplant, we have to give the clients IV infusion, antibiotic, painkiller. And then we clean all head, and then backside we have to put the bandage. And then we check every last step, everything's clear, our client's happy, he's okay, he doesn't have any pain. And then we have to send the driver at home. After that, when they have to arrive at home, after 2-3 hours, we are checking also our clients. Did you eat well? What did you eat? You have to eat tonight more protein, because this is baby hair. It needs good food. It needs blood. And then you have to drink more water, because we are putting too much water in the head. If they can drink more water, blood circulation is very easy. We cannot get swollen the head area, but after a transplant. Also, we can recommend you cannot eat chili food. This is very chili food. Yes, chili food. This is very important also. Okay. If they can eat, they are itching the head.
So what do you do for Indian patients? They love chili food.
I didn't get any Indian patient, but they cannot eat.
No chili at all.
No. After then, we are calling the clients. We are sending the message. How are you? How do you feel? Did you get your antibiotic? Do you have any pain? Do you have any blood? Blood's coming outside. We are checking this night. tomorrow also morning, also my team, they are checking again. How are you? How was yesterday? Did you sleep well? Just like 3 days not sleeping very well because we have to care the hair transplant area. They cannot fall down face. They cannot do like that. They have to use like two pillars, and then little bit the head up. They can sleep.
Now, what about other stuff? Like in Saudi Arabia, we drink a lot of Arabic coffee. Does it affect?
Arabic coffee first day they cannot. After 2 days.
ما في قهوة. ما في قهوة. No قهوة.
The other days, like they come to our clinic again, we will take the backside bandage, and then we are checking again. We have to first time washing them hair, and then we will teach them how many days they will continue at home.
Now Turkey is well known worldwide in hair transplant. It's like number one hair transplant, if I'm not mistaken, in the world.
Yeah.
Now, I've seen patients come from Europe, from America, from the Gulf. Everyone comes to Turkey to do hair transplant. Why is hair transplant so good in Turkey?
Because many years ago we started food technique, and then everybody interesting. It was successful, but we update ourselves. Also, we changed to few hair transplant. Also, everybody interesting because mostly doctors doing hair transplant in Turkey. Also, we are getting from another country for learning hair transplant. We are giving them like some education program, 1 week, maybe 10 days. They are coming to another country. We are do examination. We have exam. Also, they are doing hair transplant, like 3-4 clients. After then, they will back to them country, and then they will open them clinic or they will work somewhere.
Okay. Now, tell us more about your life in Turkey. How is life in Turkey? Tell us about Turkey.
I like my country because I am living in Istanbul. Istanbul is a very big city and a very lovely city. You can enjoy in your life the very beautiful city, very big city. My life is very quiet. I am working so hard. I am doing like every day I wake up at like 6:30, and then I will be there at 7 the gym, and then 2 hours I am doing workout. After then I will come back to home and then go to my clinic. My day like that, and then I start at 10. I finish sometimes 7, sometimes 8 in a day. In weekend, Saturday we are very busy. We start like to 8:30 and then finish 7:30 like the Saturday, because my country we can start Saturday. The government people or some private place, they are not working the Saturday. They are coming to us very easy. They will get any things.
No off days?
Sorry, just Sunday, but sometimes also I am getting hair transplant clients. Also, I am reading, I am update myself. I like to update myself. I am reading too much book. Also, I am doing yoga. I am play tennis. And then like that, I am enjoying my friend sometimes.
Good.
I like my job, life.
Good. Turkey is a beautiful country. I've been to Turkey several times. My family loves to go to Turkey, and a lot of Saudi patients love Turkey. They love to have hair transplant in Turkey and have vacation in Turkey. So I think it's a beautiful. We enjoyed talking to you. We are very happy that you came by, visited, and we look forward for you to be working with us and collaborating with us here at Rejuverat and giving our patients your expertise. And hopefully we will see you in the future in Turkey again.
Inshallah.
Inshallah.
Thank you so much. It is my pleasure, doctor. Really, I am so happy I am here. I saw you, I meet you. Nice to meet you again.
Likewise, it's an honor for me that you came. I'm very humbled and happy that you visited us, and I look forward to our next meeting.
Thanks so much.